Hello, this is Dr. Mahabub Shanawaz, consultant speech pathologist and consultant hearing specialist. We are going to talk on hearing loss as well as hearing aids and the devices that are basically there. Hearing loss is a very common disorder in the world affecting millions of people. It can affect children who may be genetically born deaf, or it can affect adults due to various environmental conditions, due to noise or disease patterns, and also because of aging. So the hearing loss, when it affects, involves communication issues. They are not able to hear the speech properly and thereby creates a social dilemma for the person. If the hearing loss is affected at the time of birth, the child loses the skill for communication development because hearing plays a very vital role for communication development. These children are considered as severely deprived of hearing, and even if they are moderately deprived, they suffer from communication disorders. For those children who are moderately deprived, we can give them what is known as hearing aids to stabilize their hearing. For those who have got severe hearing loss, where hearing aids don't help, then they have to go in for cochlear implant surgery, which is a surgical insertion of the electrodes inside the cochlea, and thereby later on seeking a very intensive and a strategic rehabilitation session ranging from several months to several years for them to acquire speech to go to the normal school. We have the cochlear rehabilitator and the speech therapy software technology which can help the patients in this regard. Regarding adults who have got hearing loss, there are various measures. First of all, they have to be seen by an otologist or an ENT specialist, and they have to do the regular audiological tests like the pure tone audiometry, impedance audiometry, and also the otoacoustic emission and Vera test. After a final profile by the audiologist about the hearing loss and the type of pathology, we go in for the hearing aid trial. The hearing aid trial consists of designing and developing the various models of hearing suitable for the patient's hearing loss, and they are tried by the hearing aid technologist, and one which suits him is taken up, and then the hearing aid is fitted to the patient either with a mold or with an open fitting too, and then programming for the hearing aids are being done. So when the programming is done properly and then the hearing aids are installed, they need a few sessions of auditory rehabilitation, after which they are very comfortable, and most of the patients with hearing aids do get very much relief and their communication problems are solved. Whereas the communication problems in children is a long drawn affair where caution and continuous support of parents, peers, as well as the relations and the school adjustments have to take place in order for the child to get rehabilitated with his hearing loss with the hearing aids or with the cochlear implant. Hence, hearing loss early detection is very important, and nowadays the early intervention technologies called children neonatal screening is going on in majority of the cities and hospitals, where hearing loss can be identified even in infants who are 1 week old, and from there on, those who fail the test, a progressive follow-up is done till we acquire what is the correct phenomenon and the degree of hearing loss. So hearing loss testing is very vital, and everybody is advised to have their hearing checked up periodically to assess whether they are able to hear properly or not. Thank you for your attention.